Welcome to the UT Physicians Enterprise Med Student Training course. Listed on the screen is the Allscripts URL and contact information. The purpose of the course, which is to provide information about effective communication, documentation, and management of patient encounters utilizing the functionality within the Allscripts Enterprise EHR. The course provides a basis for understanding how Allscripts functions and also demonstrates how the EHR may be used as a tool to aid clinicians before, during, and after a patient encounter. Enterprise Med Student is appropriate for those who are in medical school and will be doing rotations at UT Physicians. The training objectives: upon completion of training, users will have the ability to understand Allscripts EHR terminology, navigate the Allscripts EHR application to access pertinent information necessary for your role, create and edit patient care documentation, complete all components specific to your role during a patient encounter, and input all information necessary to satisfy Center for Medicare and Medicaid Services, CMS, meaningful use measures. Following completion of the course, users can expect their usernames and passwords within 24 to 48 hours. A training evaluation will be attached to the email in which you receive your username and password. We would greatly appreciate your feedback regarding the class today. And also, here is the agenda of what we're going to be covering. Lesson 1, we're going to be talking about the introduction to Allscripts. Lesson 2, the daily and provider schedules. Lesson 3, patients. Lesson 4, we'll be talking about the clinical desktop and intro to that. Lesson 5, the clinical toolbar. Lesson 6, the ACI, or what that stands for is Add Clinical Items. Lesson 7, the clinical desktop components. Lesson 8, structured notes. And the last topic being discussed will be tasking. Okay, so let me scroll back up here. And so once you have entered this URL in your internet browser, you will be directed to the Allscripts Enterprise page. Here you will enter your login ID and password. And you will hit the New Session button. The Site Selector page displays. So as med students, you will frequently change locations, so it is very important to select the site that you are currently at. This is important because such things as printers, letterhead, patient location options, patient status options are all linked to a site. So for training purposes today, I am going to log into the General Pediatrics site. I'm going to select OK. Okay, so let's talk about logging off. So within the application here, please do not use the X in the upper right-hand corner to log off. Use the log off button first. You will receive a message dialog box telling you that this will end your session. Simply click OK. Now from this point in the application, now you can use the X in the upper right-hand corner, which will completely log you off the application. Okay, so let me log back in, enter my password. Again, I'm going to select my site, which is General Pediatrics. Okay, so let's talk about lock versus logging off. To the left of the log off button is a lock button. So if you do not wish to log off completely, you can lock your session. So for instance, if you need to step away and tend to a patient, you should always lock your session. This will not only prevent patient information from being displayed for everyone to see We all know that's a HIPAA violation, but also to prevent someone else doing work under your login. So always lock your session before walking away. Once you have clicked on the lock button, the session lock page displays. When you're ready to resume work, simply enter in your password again and click on the resume button. Okay, let's talk about this clinical toolbar here. We call this the floating clinical toolbar because if I hold down the left side of my mouse on anywhere in the clinical toolbar, I can move it around my screen. I can move it down here. I can move it up here. That's why we refer to it as a floating clinical toolbar. I'm going to close it for right now. You'll notice later on in the discussion it will dock itself in certain parts of the application. We'll talk about the different icons at that point, but for right now I'm just going to close it to get it out of my way. Talk about the Allscripts framework. Okay, so Allscripts is a web-based application interfaced with a PMS, or in other words, a practice management system, which is the GE Centricity business. What we are looking at here is a workplace. The workplace is defined by a user role within the organization. It pertains to everything that the user sees on the screen according to security privileges. In this case, it's the workplace for a med student. Down along the left-hand side, we have a vertical toolbar, or the VTB. Contains all the user menus or work spaces that have been assigned to a given workplace. Horizontal toolbar, or the HTB, displays a collection of tabs or functional areas available for the vertical toolbar. You can hide the vertical toolbar by simply clicking on Hide VTB. This is just giving you a little bit more real estate to work with. Simply click back on the Show VTB to bring back the vertical toolbar. Okay, let's talk about these two tabs, the Daily tab and the Provider Schedule tabs. These tabs allow you to view the provider schedule information, most of which is populated from an interface within the practice management system, again, that GE Centricity business. Accessing schedules. Okay, so right now I am looking at the schedule for Dr. Test Provider for today. For arrived, pending, and rescheduled appointment types. To select a different provider, simply click on the All button and type in the last name of the provider you are searching for. So for instance, if I was looking for Dr. Coogan, Dr. Coogan is highlighted for me. I select OK, and now I am looking at Dr. Coogan's schedule for today. Or from this drop-down menu option, I can select from a list of previously searched for and selected provider names. So for instance, if I wanted to see Dr. Satardi's schedule for today, I simply click on Dr. Satardi and it loads in his schedule. Navigating the scheduled dates. You can use the day of the week toolbar here. So for instance, if I want to go back to Thursday or Wednesday or Tuesday, so on and so forth. I can also change the date here using the calendar icon. Simply search for the date you are looking for, select that date, click OK. And it would display a list of the patients for Dr. Satardi for September 9th. You can also use the buttons over here on the right-hand side. If you hover over each of the icons, they tell you what they do. In this case, this icon is going to take me right back to today's schedule, or today's date, I'm sorry. Likewise, the button right next to it tells me it will take me to the previous week. Button next to it Takes me to the next week. And you can just keep clicking on these and see how the date over here is changing. Again, if I go back to today, it takes me right back to Dr. Satardi's schedule. Talk about personalizing the schedule. You can always personalize the page by selecting the personalized hyperlink. Okay, it has two sides to it. This side is for the daily tab, which we're talking about right now. This side over here is for setting up the provider schedules tab, which is here, and we will talk about that in just a minute. If I set a default provider in here, this will allow this provider to be your default each time you log into the daily schedule page. Again, same functionality as on the front page. If I want to use my drop-down menu to choose from a provider I've already searched on, if they are not there, I can go to the All Provider search. Type in the provider name here that I'm looking for. Automatic refresh. This is typically left at 5 minutes. We do not suggest you set this any lower because it can slow down your session. The double click action. So when I double click on a patient's name, what do I want the system to do? Well, in my case, I want it to go to the patient's chart. You do have other options here. Again, we typically leave this set to chart. Schedule contents. As I mentioned, I am looking at the arrived, pending, and rescheduled appointment types. You do have other options you can choose from. If I didn't want to display the dictation column, which, let me move this window over a little bit, I currently am showing the dictation column. If I didn't want to display that, I simply uncheck. The All Provider view we will talk about in just a minute. Did you notice the dictation column did go away? Okay, so let's talk about the different columns and what they represent. I'm going to go back to Dr. Satardi because I know on Wednesday he has some nice icons I can show you. Okay, so if I hover over the column name, this tells me this is the charge status column. If there is nothing in this column, that means no charges have been submitted for this patient encounter yet. If there is a $sign there, it signifies the provider has submitted a charge for this patient's appointment. Note status. If you do see a note icon here, that means a note has been started for this patient. If it has a green check mark next to it, that signifies that the note has been signed and finalized by the provider. Just to make a note here, when you start your med student notes, that note icon will not display here because your med student notes are for learning purposes only. That's why they are not going to display here. Okay. Clinical summary column. Okay, this is a meaningful use requirement. It has to be offered or provided to the patient, and or the patient needs to decline and you need to set that up. Okay, this clinical summary that is offered to the patient is generated by clicking on this icon, and you will be prompted to print it out. The icon will have a green check mark like so once it has been printed and provided to the patient. The appointment status column. It shows what types of what the status of the appointment is. In this case, they are arrived. Let me go back to test provider. It gives you a little bit more here. Okay, we have more arrived appointments. Here's a pending appointment. See if I go back to Tuesday, you see a rescheduled. That means rescheduled. Some other statuses you might see would be BMP, bumped, CAN, canceled, or NSH for a no-show. Patient location and patient status columns, we'll talk about that later in the training. The time of the appointment, the patient's name, patient's MRN, the appointment type. Here we have some established patients. Here's a follow-up patient. Here's new patients. The duration of the appointment, the appointment number, according to the way the system looks at it, tasks. So tasks that are associated with this particular patient's chart. And then any comments that while that appointment was being made, if the appointment scheduler added a comment, this too comes across that interface from the PMS system, practice management system. Talk about the provider schedules tab. Okay, allows you to view 4 providers' schedules. Notice the columns are more condensed in this view. The action buttons are the same. Again, if you want to change providers, select from your drop-down list and all and or your search all feature. This too is personalized by that personalized hyperlink from now this side of the screen. And as you can see, I have set up my 4 default providers that will automatically display for me when I log in. And again, the same fields apply that we've already talked about. The All Provider view, as long as we're right here, let's talk about this. The All Provider view allows you to view a larger number of providers on that daily schedule page. Up to 20 providers can be viewed. It is limited to 100 appointments that will display. It will be sorted by time and not by the provider's name. So how did I set this up? If you click on New, you'll see the providers that I have already selected. And again, in that search field, whatever provider you want to add to your list of providers, you simply type in their last name. And we will pick Scott Bankert here. I simply put a check mark next to his name, and it assigns it over here in my selected column. If I want to add Christy, again, just a simple check, adds her to my column over here. Once you are done selecting and assigning your providers to your selected column, you click OK. Click OK again. Go back to your Daily Schedules tab. And now you need to change your provider to the All Providers view. You'll notice it has added a providers column which has all those providers that I have added in my list, assuming they have patients scheduled for this date. Okay. The action buttons down here along the bottom, you'll notice some are active, some are grayed out. They will become active as soon as I select a patient. So let's talk about patients, which is lesson 3. But before I do that, I want to bring back that clinical toolbar that we talked about. So I simply show hide. All right, so again, it is floating on this screen. Let me demonstrate that one more time. So to show hide, to bring it back, show hide again. Now notice its options are grayed out also. Again, it's because I have not selected a patient yet. Okay, so let me first of all go to today's schedule for test provider, highlight Atom test. Okay, a couple things you're going to notice. As soon as I did that, this clinical toolbar, the options on the clinical toolbar are now active, and my action buttons are active. The patient profile, we'll talk about that in just a minute. Appointment details will show all details related to the scheduled appointment. Patient appointments shows all past and future appointments for the patient that we have selected. Print schedule. I could print today's schedule. Once I filled out all the yellow fields mean they are required. So once I filled out all the yellow fields, my OK button would become active. I would OK, and today's schedule would print out for me. Print chart. This option is only available to the medical records department. And the new task button, we will talk about that later in today's training. Okay, so let's go back up here. So again, when I clicked on Atom Test, it pulled Atom Test information into this area here, which is called the patient banner. The patient banner is accessible from anywhere in the patient electronic record. It displays demographic information pertaining to the selected patient. This is called bringing the patient into context, and we did that by a single click of the patient to bring them into context. Most of this information is being pulled in from the practice management system, such as the medical record number, the sex, his age, date of birth, PCP, so on and so forth. Okay, except for this FYI information. This FYI button is yellow. It is telling me that there is information in there. If there wasn't any information in there, it would not be yellow. It would be gray, just like any other area on the screen. So if we click the FYI, sure enough, someone has added a comment in there. It says no copay in the last 3 visits. So this FYI feature may be used to document important non-clinical information, such as what you see here, or say you wanted to document their callback preference, patient lives with mother, patient's primary caregiver is their neighbor John Smith. So in other words, the FYI information is not an official part of the patient's chart, but may be used to use for patient documentation. So in other words, read this note here. Entries in the box below are not part of the patient's medical or billing record and should not be used as such. The current version is saved in the system and is accessible by other users. So other users can see this, they can add to it, they can delete it. So be careful what you enter here. Okay, let's talk about this blue eye. This is the patient profile. It will take you to the same spot as this patient profile button. Patient profile is where you can view the patient's clinical, demographic, employer/contact, and insurance information. Again, most of this information is populated by the PMS. You can also view and update the FYI, chart alerts, and pharmacy information. Okay, so here's the FYI. Chart alerts are visible by any user who has the security to view the patient's clinical record. Unlike the FYI information, a chart alert is the equivalent of a red underlined note on the front of a paper chart and contains clinically relevant information. It will display in red text on the clinical toolbar. Up to 3 chart alerts are allowed. If the patient already has 3, it is okay to remove 1 and then add. So in other words, if I needed to add 1, it's okay to delete that one. Click on the Add Alert. Scroll down. You can see that I do have a list to choose from. Now, we do prefer that you select from this list. You can add free text alerts, but we really discourage that. If you notice that you're always adding the same chart alert frequently, let the Allscripts team know, and they can add it to the system for you. Okay, so I just simply check the one I want to add. It adds it to my selected items at the top, and click OK. So let's scroll down to the patient communication. Okay, now again, this goes back to that clinical summary that we already talked about out here. So because this is a meaningful use requirement, it must be printed. If the patient declines, this is where you can set that up. So your options here that will meet the meaningful use requirement are either print or declined. So in this particular case, I can see that Test Adam has declined, always wanting his clinical summary as he leaves his appointment. Once that is set to declined, his clinical summary this icon will always have an NA. So in other words, you know that that patient has declined it, and that's okay. Again, you will still meet the criteria for the meaningful use requirement. Okay, let's go down, and again, you'll just see employer contact information, insurance information. Again, all this is coming from that practice management system. You cannot edit it. You can, however, enter pharmacy and mail order information. Right now, this patient's preferred pharmacy that he'd like his medication sent to is the Walgreens drugstore. It is a default. If you'd like to add other retail pharmacies, simply click on the binoculars. You can search through this list. You can see it's quite long. Or if you know that if the patient tells you the name, or if they have a phone number, if you know a zip code, you have several different fields that you can search by. Let's say he tells you he goes to the Walgreens on Fannin Street, or in the Fannin Suite. So if I select that, say OK, now you'll see that that one now becomes his default pharmacy. Same functionality within the mail order. If you wanted to remove one, simply highlight the one you want to remove and select remove. Okay, this is a really nice feature. If you can set this up ahead of time for the patients, it will just save the physician time down the road that when they are doing e-prescribing, when they are prescribing a medication, this pharmacy will automatically default in a field for him, and it just saves him from having to select the pharmacy himself. Okay, so, all right, let's talk about the alert icon right next to the blue eye. It is red. It is telling me I have some alerts here. Okay, so this just shows documentation that's missing from the patient's chart and that it needs to be satisfied. Again, this is a CMS meaningful use measure. So you can see here, it's an MU measure. The meds list and the allergies list, neither of those have been reconciled for this encounter. That is usually a function of a nurse or a physician, so you probably won't have to deal with that. Select patient. Let's talk about searching for other patients. Okay, if you are trying to find a patient that isn't on today's schedule, you select this drop-down, select search. You can type in the patient's name right here. You do have other filters from which you can search. For instance, date of birth, medical record number, so on and so forth. I know my patient's name. It's Test Baby Boy Blue. Highlight Test Baby Boy Blue, select OK, and notice now Baby Boy Blue's information has been loaded into the patient banner. But you'll notice Test Baby Boy Blue has a capital R, and next to the security field we have a break glass. Okay, so if a patient's chart has added security, this will monitor those who do not have access to enter the chart. Break glass reports are run periodically to review chart access. So the system won't prevent you from getting in there, but you do have to break glass to get into this patient's chart, and you are warned that all actions will be logged. You are overriding patient data security. If you proceed, all subsequent actions regarding this patient will be logged and flagged as exceptions to normal access. You must confirm your username and password to proceed. So if I really did still want to proceed, I would enter my password. I would give it a reason for why I'm accessing this patient's chart, and I would select OK. So now an audit trail can be run on who, why, where, and when, and what you did while you were in there on this particular patient's chart. Okay, so we're going to go back to not only today, we are going to go back to Test Adam. All right, so let's talk about Lesson 4, Clinical Desktop, the intro to the Clinical Desktop. Okay, this is the patient's chart. This is where all the patient's information lives. The Clinical Desktop is composed of several different components, or tabs if you will, each containing different clinical information. So If I double click on add them, because that's the action that's my action default, where is it going to take me? That's right, it's going to take me to the patient's chart or the clinical desktop. Here are the components that make up this clinical desktop. Component arrangements are dependent on the clinical desktop view which you are assigned. We are looking at the adult patient view. Again, because you will be rotating to different clinics, you might see a pediatric view, you might have an OB view, you might have a surgical view, just depends on where you're working that day. Okay, so each component has a series of views that filter information and another that sorts or arranges the information. The layout of this screen is in tile mode. You can see on this tile, which is split right here, it has these different components on it. Over here on this tile is comprised of these different components. We can switch to full screen. So now instead of being in tile mode, each component now takes up the full length of the screen, which on some of these components is very nice, like for instance the one that we're in, the health management tab, or a flow sheets component is nice in a full screen mode. Your vitals is nice in full screen mode. But you can toggle back and forth. If you want to go back to tile mode or go back to full screen, your choice. Okay, let's talk about what each of the components are. Chart viewer. The chart viewer component allows you to quickly review clinical documents for the selected patient. These documents include structured and unstructured documents, results, encounter forms, and scanned documents. The problem component allows you to quickly review and manage the selected patient's problems. Okay, there must be something present on this list to satisfy the meaningful use requirement. So the patient has to have active problems. That is an MU requirement. Health maintenance plan. This gives a broad overview across continuum of care by diagnosis. The component allows you to see the most recent result for an order and the date it was resulted, if the schedule has been created for an order, and if a schedule order is due. Vitals. This component displays a flow sheet of the selected patient's vitals data displayed as a grid that have been recorded for a patient over a period of time. Flow sheets. These are typically group specific. So for instance, you are looking at endocrinology. They have a diabetic flow sheet that has been created for them. Encounter. The encounter component allows you to quickly review historical encounter information and manage the current encounter for the selected patient. Anywhere you see a plus sign, you can always open that up and or double click to view further information. Over here, the meds component. It contains a list of the patient's active medications. Again, you've got some plus signs. You can open it up to see more information, and or if you double click on that med, takes you to the medication viewer, again, allowing you to review more detail. Allergies component. The all allergies is the default, sorted by urgency. You could sort it by type. So now you're seeing all the medication allergies that this patient has and all the non-medication allergies the patient has. The Orders tab. This displays a list of all current orders and the status. Immunizations. Displays as a spreadsheet. Immunizations are listed on the left. And again, just gives you a recording of past immunizations that they've had. And last but not least, the patient work list. will show the patient's orders and results that need to be authorized and or verified. This function is usually performed by a provider. Okay, lesson 5. Let's talk about this clinical toolbar, which has now docked itself. Now remember, on the daily page, it was floating. On the clinical desktop, it will dock itself. Okay, let's talk about the icons. This icon right here, we select the drop down and select Quick Chart. This does display the clinical desktop in a separate window, so you do not have to navigate from the current screen. So if you wanted to stay on this current screen but you wanted to view the meds, you could do that. That's how you would do that. Likewise, on the quick appointments, again, allows you to view all past and future appointments for the patient in context. Again, you don't have to navigate away from the screen that you're in. The little blue guy, or the encounter summary, allows you to view alerts for the patient in context and any information entered into their chart during the current encounter. The heart, this is where you are going to enter the patient's vitals. So after you get done taking the patient's vitals, you will click on the heart. Or as you're taking them, you can certainly enter them. I'm going to make this screen a little bigger. I prefer a bigger screen. All right. The numbers down here in gray are all the previous recordings. So I'm actually going to enter some information in here. The weight, oh, he's still in 191. Blood pressure is 120/72. You could give a location and a position if you want. Again, you can enter as much or as little information in here as you need to. 97.5. Pulse will say is 67. Respirations will say are 19. And the O2 sat will say is 99. Okay, so again, once you've done entering as much information as you need, simply click OK. The P, this is for problem. This is where you would enter problems. This routes you to the ACI History Builder primary tab and various secondary tabs, depending on which option is chosen from the drop-down. So let me just demo that. Okay, so takes me to the History Builder primary tab. It has corresponding secondary tabs, which we will get into much more detail later on. Okay, back to the clinical toolbar. This prescription, this is an RX, this beaker, this problem-based orders, and the clinician's choice, these 4 icons all pertain to ordering. As med students, you will not be ordering, so you will have no need to go to these 3 buttons, or these 4 buttons. One is for ordering medications or e-prescribing. If you select this drop-down, that's where you could order a lab or a procedure. I could order an imaging test. I could order a follow-up or a referral, so on and so forth. Like I said, you will not need to use those 4. Next one over, however, is where you can start a new note. You will be doing that, and we will discuss that later in the training. The commit button, you'll notice it is yellow. So again, it's trying to draw my attention there. It's saying that I have entered information that I need to commit. So if I select commit, it takes me to that encounter summary, and sure enough, I have information displaying in magenta. So anytime that you do see magenta information, that means it has not been saved yet. Once you have saved that information, it will display in black text. So I can hit the continue button, but if I do that, it does not save. It only closes the encounter summary. Save and continue commits the current information to the patient's medical record, and closes the encounter summary. Save commits unsaved items and keeps the encounter summary open. And then your delete unsaved, it cancels and deletes any unsaved items. A warning message will display asking you to confirm your choice to delete all unsaved data. Okay, so in this case, obviously, I want to save and continue. Continuing over, we have the patient location and the patient status. Okay, the options that display here are based on the site that you selected when logging in. This ties back to our earlier discussion of selecting the correct site. So the patient location, these drop-downs are the exam rooms, the names of the exam rooms for pediatrics. If I were to sign into internal medicine, the names here would be different. Likewise, if I was in OBGYN or if I was in otolaryngology, these options would be different. So say I select the patient is in O2 Red 5, the status. Now the statuses here are typically shared by all sites, so these are pretty common to everybody. Everybody wants arrived, okay, the patient has arrived, or the patient is nurse MA ready. The patient is in radiology. The patient is roomed. Okay, so there again, location, very specific to your site. The statuses are typically shared by all sites. Okay, lesson 6. Let's move on to the ACI or Add Clinical Items screen. Again, before I do that, I want to use a different patient. I want to get Test Alexander. If I double-click on Test Alexander, it takes me to his chart or his clinical desktop. Okay, so if I select the P allows me, as I demonstrated earlier, allows me to go to the ACI. The ACI is where all clinical items are added as discrete data into a patient's chart. The clinical toolbar will guide you to a specific tab within the ACI, just as I demonstrated there. The P took me right here to the History Builder tab. Now, the majority of the information that you, as med students, will be entering in the patient's chart will be driven from that P. So remember, that P is your friend. That's how you're going to get to the Add Clinical Item screen. Okay, let's talk about this ACI layout. Primary tabs are across the top here. History Builder, RX/orders, problem-based orders. These two tabs, because they do pertain to ordering, you'll not have any need to go there. You'll stay here on the History Builder, working in the secondary tabs along the bottom here. The panes on the left-hand side, this top pane corresponds to the History Builder secondary tab that is selected. So in this case, because I'm already on the Active Problems secondary tab, that's what's displaying here. It is giving me all of the active problems that have been added to this patient's chart. If I move over to the past medical history, displays the histories that have been added to the patient's chart. Past surgical histories that have been added. Family history that's already been added, and the social history that's already been added. This next pane is showing me the current meds and orders. Again, like we've already discussed, I can change the view. I can select from any one of these views. And likewise down here, the allergies, we've already discussed that. These are all allergies. He has allergies. He gets hives when he has nuts or when he eats nuts. Okay, let's talk about the filters across the top here. This is your search field. We'll come back to that in just a minute. You'll notice my favorites categories has defaulted to my favorites. I could change this to a specialty, for instance, to the pediatrics, This would now display a list of all the pediatric specialties, or the pediatric specialty favorites. If I changed it to family medicine, it doesn't have a lot of favorites, does it? Let me go back to pediatrics. That's because I had this filter on. Did you notice? Okay, when it's green, that means that the quick list filter is on. So when I'm in my favorites, it's not only my favorites, but it's my quick list favorites. If I were to turn this filter off, my favorites are now a longer list. So your quick list is more or less a favorite of your favorites, and I'll show you in just a minute how you create a favorite and or a quick list. And on the active filters here from this drop down, we do suggest that you click return results with ICD-9s only. This will just help shorten the amount of returned search items for you. Okay, so let's go back to searching in the ACI. Usually partial words, or if you know a keyword or an ICD-9 searches tend to be the best. In the search field, if you are searching for, say, meningitis and it isn't already in your favorites list, if I'm searching for meningitis and I do want to add that, whoops, if I could type. And I hit my enter, okay, brings meningitis right here. So all I would have to do is put a check mark, and it adds it now to this patient's chart in the active problems. If I was wanting to search for another one, I can simply click the green arrow, backspaces that out of there for me, say I'm looking for mumps. Notice as I type, it comes right to the top for me because the system is doing incremental searches here. So the first search that it does, it's going to look for that item in my favorites or my quick list. Then it's going to look to the specialty favorite, and then if I hit the enter key or the binoculars, it then is going to search the master database. So it's bringing mumps right up here for me because I do believe I have that in my, yep, it's in my favorites list. Okay. If I were to search, if I knew a ICD-9 code, so I want sore throat, and I happen to know that 034.0 is the ICD-9 code for that. I'm looking for streptococcal sore throat. It's right here. Now, let me show you how the favorites and the quick lists work. Okay, so if I find that I am always searching for that, why not save me time? I don't have to keep searching for it, just add it to my list. So if I do a right click of the mouse, you can see I have it as a favorite item and I do have it as a quick list item. This can be toggled on and off. So if I take it off of my favorites list, it automatically goes away from my quick list. So let's demonstrate that. So if I go back to my favorites list, you'll notice it's no longer there. If I put it back on, and I add it to my favorite list, notice when I add it to the favorite list, it did not automatically add it to my quick list. However, the reverse is true. Anything that I add to my quick list, it does automatically select this one and add it to my favorites list. So now it should be in my favorites list, which it is. Is it in my quick list? It is not. Okay. Let's move on to the second one. past medical history, and the searching applies to every tab here. So when you're entering in this patient's information, you're going to stay right in this ACI window, and you're just going to go right down the list of these tabs. So the past medical history, say you were searching for, you knew that you were looking for conjunctivitis and it was 372.00. There it is. It brings it right to me, acute conjunctivitis. And again, just check it, adds it to the past medical history for me. Past surgical, he tells you that they've had ear surgery. It is right there in my favorites list. Say they tell you he's had back surgery. Okay, again, brings it right to the top for me because it was either in my favorites list or it was in the specialties list. Family history. Now you can add by family member. Now you must select the diagnosis after each change of a family member. So if you were to say that the entire family history, they have a history of diabetes, you would select the family history. If it was just the father who had diabetes, oh, okay, we already have that. Okay, so do I wish to add another instance? No. All right, so say it was the father had sinus surgery. Okay, notice if I also wanted to add that to mother, I have to select the diagnosis again. So for each family member, you must select the diagnosis afterwards. Okay, social history. Now, this is where smoking, alcohol, drug use, the living situation, etc. are added. The smoking status must be entered here. It is a meaningful use measure, and it needs to be, now in this particular case, never a smoker has already been documented. If it hadn't been, this is where you must document. If you type in smoke, you see you have several different options. He was never a smoker, former smoker, current everyday smoker. So just remember, the smoking status must be documented. Allergies. Okay, if the patient is reporting no active allergies, again, this is a meaningful use requirement. You must document that. Otherwise, document the allergies that he's telling you he has. So in this case, let's say, so anyway, you would select either no known allergies or no known drug allergies, or document it. He's allergic to Septra. I select, it adds it to my allergies section. Now in this case, I also want to add a little bit more detail, especially when it comes to an allergy. Okay, what happens when this person takes a Septra tab? If I double click on this option, it takes me into an allergies details page. Under the reactions, if I click on the binoculars, it gives me some allergy reactions to choose from, and in this case, he gets the hives. Okay, so once I'm done, I can either save that information and return to that ACI screen, or if I was done doing my documentation and I wanted to close the ACI, I would choose this option. But I'm not done, so I want to save and return to the ACI. Med history. Now again, all historical meds should be added here. Okay, if the patient is not taking any current medications, you must document that here by searching for no reported medications. Right here. Okay, again, a meaningful use requirement. So you either add the meds that he's taking or select no reported medications, which when which someone has already documented here. But let's say he tells you he's taking, he has taken acetaminophen. Okay, so you can see it returned quite a few options here for me. So I can either scroll through here and look for the one that I'm wanting to choose, or I could have typed out a little bit more information. So this is just a good example of usually a partial word search is the best, but sometimes when you've got so many options to choose from here, a little bit longer letters or a little bit more of that name would have helped a little bit here. So for demonstration purposes, I'm just going to say the acetaminophen tabs over the counter. Okay, and the immunization history. So I do have some favorites listed here. Say they tell you he had his polio shot last year. They don't remember quite exactly when. This is where it's nice too. You're just recording the history. So if you click on the calendar icon and the date and time, you can use an approximate. So you can say, well, if he tells you I approximately had it sometime last August, I believe. And you can say it was around the 7th. So the system does allow you to use approximate dates. Again, I want to save and return to the ACI. Okay. Couple more searches I wanted to show you here. If we go back to this screen and we search for heart surgery. Okay, so see if sometimes what you're looking for, it doesn't quite return everything or quite the exact words that you're looking for. So there again, if you know the ICD-9 code, that is the better way to search, or back out some of this word and type, or then hit your enter key and look for just the word heart. Now it is searching the entire database. Okay, so notice it starts right with all the A's. Now you know you're looking for heart surgery, so a couple different ways I can get to it. I can use my scroll bar down here on the bottom, or I can use the alphabet over here. So if I click on the H, it should take me right to any of the items that begin with H. So in other words, heart disease, heart valve, I mean, what am I looking for? Say I was looking for heart disease. It's right there. Click it, adds it to the active problems list. Okay, so last but not least, chief complaint. You're not going to be using that tab, so you can ignore that. I am done documenting the patient's active and all his histories. So I'm going to select OK. I'm getting an interaction warning. You may run into this, so it's just telling me there's a contraindication here. Chronic use of this drug should be avoided in patients with underlying renal, cardiac, pulmonary, or hepatic disease. Okay, I can continue. I have that yellow commit button. Going to select. Again, it displays all the information that I have just added in that session. It's in magenta. Save and continue. Okay, so back to the clinical desktop. All right, so there are some icons within each of these components. They do vary by component, so just hover over each one of them to discover what the icon does. So for instance, this is edit view, this is a search, this is a quick filter. So like I say, they do vary by the component that you're in. However, there are some common to all the components. For instance, the refresh button just refreshes your list. The expand and collapse will expand or it will collapse. Then you've got the new task button, which tasking we're going to talk about a little later on. Okay? All right, lesson number 8, let's talk about structured notes. V11 structured notes. All document types are assigned a finalization authority. If a resident or a fellow signs clinical documentation, they will be prompted to send a task to the attending physician. Best practice is to always start clinical documentation off of the schedule. Medical students, your notes will not need to be routed to the attending for further signature. Now, as we've already discussed, because your med student note is for learning purposes only, it's not going to be requiring an attending physician to sign those. Okay, so back to the schedule we go. With your patient highlighted and his information pulled into the patient banner, 2 ways you can start the note. I've already shown you this icon on your clinical toolbar. You can start a new note that way, or you've got a select note button from the patient banner. So I'm going to select. Make sure the specialty defaults to the specialty you're at that day. It should default to the one you're logged in at. If it isn't, you can choose it, can choose a different one. Make sure the owner is the attending provider of the clinic that you're at. In this case, it does match test provider. And then your visit type, if you select from here. Now again, you'll have different visit types or note types, if you will, depending on the clinic that you're at. So these will vary. But you want the student note. Click OK. Okay. The note authoring workspace displays. Notice again that clinical toolbar has docked itself. You do have some patient demographic information at the top. You have some appointment clinical encounter information also displays. Okay? You also have not only the note component, but you do have some of those other components just like you have on the clinical desktop. So you got the problem component, you got the chart viewer, meds, allergies, so on and so forth. So right now we're going to be in the note component. Down along the left-hand side here is called the table of contents. There are different sections in the table of contents based on the note type that you're in. This area here is known as the NAW, the NAW, the Note Authoring Workspace. This is where you're going to do most of your work. Down here, as you work, you've got the accumulator area. And then over here in this corner, you've got the note, student note, which is your output. That's the output that's going to be sent to the chart viewer component of the clinical desktop. Okay. The chief complaint section is already highlighted for me, and notice that's the area that is in my work area. As you scroll down through these sections, that section is what's going to be pulled into context for you, allowing you to do your work in your work area. It also will correspond to what's being pulled into the accumulator. So family history section here for me to work in, also down here. Allergies, same thing. Down here in the accumulator, wherever you see this gray bar, that means if you place your cursor in it, you can always type free text. Okay, anywhere in that accumulator where you see that gray bar. You can always view your note output. Now, as you're working here in your workspace, what's what's being displayed down here in the accumulator isn't always what's going to be accurately displayed in the output. So anytime you want to view your output, you can click on the View button, and this will display your student note, everything that you've added so far. So there's the active problem, surgical family. Okay, to get back, simply click the Close button. Okay, we're going to go back up to the chief complaint, and we're actually going to start documenting within this note. Your chief complaint should always be entered as a free text. In this case, he was complaining of an earache. Going right down to the next section, which is the student history of present illness. This form here has been hard-coded in for you, meaning that it's always going to display there for you. It is a free text box. You can type in whatever you need to document in this area. We have given you a little reminder of what you might be documenting within an HPI section, such as things like location, quality, severity, so on and so forth. So you might document something such as pain in right ear is severe. Active problems, again, this information is coming from the patient's chart and it's being auto-cited in for you. Same thing with the past medical history, surgical, family, social, his current meds, allergies that have been documented, immunizations, vitals. Had we taken any on the patient today? Remember we were on ADAM test when we documented those vitals. We had documented some vitals on Alexander. They would be displaying here. Student physical exam. Now, because this form is based on the patient's age and gender, we did not hard code that form in here for you, unlike the UTP student HPI form. So in order to load that form in here, if you do a right click on this section, choose Add Form Bottom, you'll see you have 4 forms to choose from. Now, because this particular patient is a 4-year-old male, I'm going to choose the Infant Multisystem Male Student form. Place a check mark next to the form I want. Select OK. And you notice the form is now populated. And again, you can fill in as much information or as little information as you need to. So you can go right down through here. The general appearance was normal. The inspection of his head, normal. Eyes, conjunctiva, and lids were normal. The assessment of his hearing, let's say that was abnormal, and you wanted to document additional detail. That's what these buttons here are for. They're called degree indicators. If you click in that little circle, you can then document additional detail. So we'll say, yeah, his hearing, yes, he reacts to sound in the right ear, and reacts to sound in the left ear. You can also, what these boxes here are called, they are free text boxes. If you wanted to enter free text such as hearing in the left ear is good, for example. So again, we just keep going right down, and again, you document as much or as little as you need to, either going into the degree indicators and or filling out the free text field. Okay. The results data section, again, if this patient had any results data that had come back through that interface, it would be displaying in here because they do have the filter set at the last one instance. So in other words, that means the last set of result data that came back would be displaying here. Student assessment. Again, This is they hard-coded a free text form here for you. So again, it's free text, whatever you think is necessary to document in this area. So you diagnose, say, this patient has an ear infection. That's your diagnosis. The student plan form, again, hard-coded in there for you. It's free text. Again, whatever you feel is necessary that you need to be putting in there. Your plan for this patient is gave anti-inflammatories. And the signature section, this will be filled out once you sign it. Okay, so I always like to view mine before I do anything else. So I'm going to go to the view again, and I'm just going to go down through here and make sure it has what I just documented. Sure enough, there's my chief complaint. There's what I entered in the HPI section. Here's all the section information that auto-cites in for you. Here's that student physical exam with all that information that I selected. Notice it even added the area that I added the additional information to, and hearing in the left ear is good. That was my free text information that I added. There's the assessment that I added, and then there's the plan. I didn't spell that right, but I think you get the idea. Okay, so we close. We go to sign. You enter your password. You are the author. It is going to make it final. You click OK, and you have just documented your first student note. So let's go take, I just want to show you where that displays. Okay, so back in Test Alexander's clinical desktop, if you go to the chart viewer, you'll see that there it is, the test student note. Now, one thing to keep in mind that, again, because your test student note is for learning purposes only, the only people that are going to be able to see that in the chart viewer section is the attending, the nurses, and med students. Okay. Last but not least, let's talk about tasking. So in your VTB, your vertical toolbar, if you select tasks, the task page displays. Okay, what is a task? Okay, a task is a request or a reminder for action. Typically, there are two types of tasks, action being one of them, which is it requires an action to be performed, or a message, which is like an email. You'll notice the view that should always default for you is My Active Tasks. So these are tasks that have been sent to me that I need to work. Now, typically you do have a couple other views. You usually have the current patient all and a current patient active, but that does depend on the clinic supervisor. They're responsible for assigning and managing of the enterprise task views, so that's all up to them what other views they want to give you. Typically, like I say though, these are typically the three that we assign to everybody, My Active Tasks and current patient, active, and all. Okay. Let's talk about the columns. So priority, meaning what is the priority of this particular task type. And I'm going to switch patients for just a minute because I want you to see, I've got some good examples of different priority icons. All right, so when you see the priority of this red sunburst or starburst, it means they're urgent. When you see the yellow triangle, that means it's ASAP, as soon as possible. So your urgents and your ASAPs will always populate to the top of your list, followed by the rest of them in date time order. Okay, your delegated column. This means, is this particular task type delegated? You can see here I've got these two are delegated. A delegated task is usually assigned to the attending or the ordering provider, but that does not mean that that ordering or attending provider is expected to work that task. Usually that delegated task is put into a different view, and that view is then assigned to his or her nurse, who then works that task. So those are tasks that we typically don't want to be, to have the attending or the ordering provider. We don't want them being bothered with those task types. So usually the nurse and or the MA is going to take care of those for him or her. Your task column tells you what type of task is it, who's it assigned to, or what patient is pertaining to, who this task is assigned to, who it was created by, the created by date and time, what status is it in, the ID as it pertains to the system. You can ignore that column. Okay, is it overdue or not? If it has a red frowny face, it is definitely overdue. And then the patient's medical record number. Okay, so I want to go back to my active tasks because these are the ones that I need to work. Once again, I'm going to close this floating clinical toolbar to get it out of my way. And we are just going to walk down through here. Now, you are expected to work your tasks. As you work them and complete them, they will fall off your list. So let's take this first one. All right, so the comments down here, you can see that Nancy sent me this task. It is a callback task type concerning ATOM test. It says, patient is complaining of excessive post-op swelling. Please call. Now, if this is too little of an area for you to look at, you can always click on the details button, and it just gives you a little bit bigger page to look at. Same thing, patient complaining of excessive post-op swelling. Please call. Okay, so I try to call that patient back. I get his answering machine. So what do? I document that. Always document anything that you've done related to a task. It's CYA. So in other words, cover your butt. So I'm going to document that in here. I'm going to say, call patient back today, got answering machine. We'll try again tomorrow. Okay, so I've documented what I did, and now I am going to put this one in progress. That not only tells me, but it tells someone else, hey, someone is already working this. Don't bother working on it. It's in progress. I'm dealing with it. Okay, so let's work the next one. I've got another callback. Patient has questions about meds. Please call back. Okay, so again, I call the patient. I answer his questions. I'm going to document that, aren't I? So, call the patient today, answered all questions. Okay, again, I've documented what I've done. I click OK, and now I truly am done with that. I'm done. I've done what I was asked to do, so now I can done it. Removes it from my list. Next one. Nursing home has questions about patient's meds. Please call back. Okay, so again, I'm going to document in here. called nursing home. All questions answered. Okay, and I done it. Next one. Okay, nursing home has questions about patient's meds. Please call back. That kind of looks like the same one, doesn't it? So that kind of tells me, and it's even on the same patient. Nancy probably didn't remember that she already sent me one. So I'm pretty sure that this is a duplicate. So this is probably about the only time that you can use the remove button. Because if you'll notice, once I click remove, you've got to give it a reason. It's not needed. I'm going to make a comment in here why I don't think it's needed. I'm going to say it's a duplicate task. Because if you are starting to remove more tasks than you are working, the clinic supervisor can run reports and it will show tasks that have been removed, and you might be asked, okay, why are you removing your tasks instead of working them? So in this case, you do think it's a duplicate, so this would be an appropriate example of where you would use the remove button. Okay, and again, removes it from my list. A follow-up. Okay, have you scheduled patient's hearing test yet? Okay, so Nancy wants to know if I have scheduled the patient's hearing test. So I can simply reply to her. And I can say, yes, it is scheduled for Monday. And notice when you use the reply button, it automatically sends it right back to the person who sent it to you. So yes, it is scheduled for Monday. I click OK. Okay. Again, removes it from my list. I see I have another follow-up. Have you set up patient's imaging referral yet? Well, I don't do that, so that looks like it was sent to the wrong person. That shouldn't have gone to me. So this is where I can reassign it. Now, it looks like instead of going to me, it should have gone to, I'm going to change my radio button to team, and I think it should have gone to the UT imaging schedulers. And that's all I have to do. Use the reassign button, assign it to the right team and or the right person that it should have gone to. They can see the comment. That's all I have to do, and I'm going to click OK. Okay, so now I'm down to my last one. And I'm going to highlight this callback task type just for a minute here, because you'll see that on certain task types, notice all the buttons that are active and inactive, particularly the Go To. Once I highlight this task type, that Go To button is active now. It's telling me, go to this result. So I click Go To. It brings up the results. Now the nice thing about a Go To result is that I can just lower this. Patient's phone number is right here. I can get them on the line. I've got the test results right here in front of my face. I can give them their results. When I'm done, and I have done that, I simply done it. And now I have just worked all the tasks that are assigned to me in my active tasks view, except this one that's in progress, and I will work on that tomorrow. And folks, we are done. So that concludes today's training. Thank you very much for attending. Have a great day.